Is this thing recording? Okay. Hi, my name is Brittany Power. I'm doing a presentation on chronic obstructive pulmonary disease, also known as COPD. Here goes. According to the National Heart, Lung, and Blood Institute, chronic obstructive pulmonary disorder, also known as COPD, is the third leading cause of death among Americans in the United States. Studies also show that by the year 2020, it will be the second leading cause of death. With that being said, what if I said everyone in this room would be diagnosed with COPD at some point in their life? Would you know the signs and symptoms? Could you manage having anxiety, activity, intolerance problems due to the symptoms related to COPD? Could you imagine having anxiety or panic attacks related to narrow airways, just not being able to breathe at all? Well, if you can imagine those things, then prevention is the key. The number one leading cause of COPD is smoking. Some people develop COPD from air pollution and chemicals such as working in textile mills, but this is very rare. Typically, the number one cause is smoking. Today I will talk about chronic bronchitis and emphysema. These two things are common disorders associated with COPD. And asthma in certain cases is also associated with it, but most people just have bronchitis or emphysema, or they have both. Most likely if they have COPD, they have symptoms of both. Quick fact, bronchitis equals severe cough, emphysema equals shortness of breath, asthma equals wheezing. If you know anyone experiencing all three symptoms, chances are they have COPD. Okay, so what is the normal lung function? What are the purpose of the lungs? The main purpose of the lungs is just proper gas exchange. Inhale, exhale, without any respiratory distress. Okay, someone with COPD, they have a hard time exhaling air. Generally, someone with a normal stimulus to breathe, we breathe, such as myself or anyone who doesn't have any respiratory disorder, we normally breathe from increased levels of carbon dioxide. We're trying to just blow off that, excessive carbon dioxide. But someone who has COPD or any respiratory disorder, most likely their stimulus to breathe are decreased levels of oxygen. And this is why you can't give a COPD patient high levels of oxygen, because it kills their respiratory receptors. And once those are gone, they can go into respiratory failure. And here's how it works. Normally, breathing is an involuntary stimulus. So, someone with COPD that's receiving high levels of oxygen, this is how the receptor thinks. Don't breathe, don't breathe, don't breathe, don't breathe, because they're receiving oxygen. So they get lazy and eventually they die. So if you take someone off high levels of oxygen, their receptors don't remember to breathe, 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 breathe. That stimulus is just completely gone. So that's one main reason why they can go into respiratory failure. Okay, so bronchitis. Bronchitis is basically just a severe cough. It's where the bronchial tree is inflamed. And basically that reason being is from the villi has stretched out so far. It's stretched out, which allows more space for the mucus to pool around, causing people with COPD to have a severe cough. Emphysema, that's just shortness of breath. And the reason being is because the mucus producing glands are just hypertrophic. They're just going crazy. They're just constantly producing that thick mucus. And someone with COPD, they don't have that stamina to cough that up. They can try, but it's hard because it's so thick and it's so much. They're like so congested. I know you probably have been out in the store and you've seen people where they're constantly coughing, can't catch their breath. Most likely that's a COPD patient or somebody that's in some type of respiratory distress, because they're having a hard time getting that mucus up. And in certain cases like that where someone has a severe cough, they suggest you, provide extra fluids and give them mucolytics. Muca equals mucus. The purpose of that medication is just to thin out the mucus, allowing the COPD patient the ability to cough up that mucus. Someone that is short of breath, you just thinking, you just need them to breathe. So you give them oxygen, but you don't give them high levels. You can give them 1, 2, the max is 3 liters of oxygen per minute for someone that is a COPD patient. Someone who has asthma symptoms that is a COPD patient, you give them a bronchodilator such as albuterol. That is the purpose of albuterol is, like I said, it's a bronchodilator. It's meant to stimulate the beta receptors to dilate, so that increases your airway. Yeah. What are some causes and nursing managements of COPD? Like I said earlier, the main cause of COPD is smoking. Nursing management, if you know someone that is smoking, the best bet is for them to stop now. This type of disorder is only progressing. It gets worse. The more they smoke, the worse it gets. Stop the smoking now if you can prevent it. And like I say, nursing management, you just oxygen therapy, no more than 3 liters. Medications such as albuterol, which is a bronchodilator, the purpose is to increase the airways. Breathing exercises, there are 2 that's called pursed lips and diaphragmatic breathing. I won't go into much details about those. And yes, I'm just going to wrap it up today. If you are a smoker and you know someone who smokes, ask them important questions. Do you enjoy walking, playing with your grandchildren and children, or even just being able to ambulate without respiratory distress? If so, educate yourself and others on the importance of not smoking and the damage it can do to your lungs. Smoking doesn't just affect your lungs, it changes your entire life. Certain activities that may seem easy can be quite a challenge for someone who has improper gas exchange. The best way to manage and or prevent COP is to not smoke at all. If you are a smoker or you know someone who does, encourage them to stop now. This is a progressive disease. Day by day it only gets worse. Don't be a slave to cigarettes. Smell the coffee and roses without coughing.